Hello, I'm Shannon. I am a clinical fellow, a speech pathologist at Woodlake at Talent. I am a fan of FEES because they give us a lot of information that we wouldn't know just at bedside. So when I'm concerned about a patient swallowing, I often look into their chart and I see some other factors that might be red flags, like CHF or COPD. And in those patients, if they coughed at bedside, it could be related to their respiratory issues, or it could be related to a swallowing problem. So I usually ask for a FEES in that case to really rule that out. I had a recent patient who was sent here as NPO, so nothing by mouth, and had a PEG tube for nutrition and medication administration. This individual had a a massive stroke and was left with impaired swallow at bedside. So they decided to go that route with the PEG tube. And when she came here, I have been working with her with the Fraser-free water protocol and trying to kind of get her oral responses to both ice chips and liquid and putting thickened water. And at this point, she had been making a lot of progress. I decided it was time to do a FEES to see if she was silently aspirating anything. Because of the massive stroke, I really needed to be sure before we decided to start a diet. And this test went really well for her. And at this point, she's now starting a full, a PO diet. So she's eating puree and thin liquids with staff, and I'm expecting to upgrade her even further with more trials. But if I didn't do the FEES test, I wouldn't know and be confident that she was safe to start a diet. So in order to reduce the chance of someone getting sick, a pneumonia, or back into the hospital for medical decline related to aspiration, we really need to do a FEES to be sure. And that's why I do them.